Awesome. So welcome to tonight's webinar on cesarean birth and the what, why, and how. It's really important, even if you don't experience or have to have a cesarean, to kind of understand what to expect going in, because if you get to that point when it's necessary to have a cesarean birth, either due to the things that we'll talk about tonight, it feels a lot more comfortable kind of understanding what that's going to look like as you go forward. And my name is Allison Rollins. I am one of the owners and doulas and childbirth educators here at High Country Doulas. We love to help answer questions for parents and help them feel a little bit more calmer and a little bit more aware of what to expect when it comes to your labor and birth. So as I said before, if you have questions, feel free to put those in the chat bar. We're so glad that you're here to learn a little bit more about understanding cesarean birth and what that entails, in case that might be your path for your birth, sometimes called belly birth. All right. So welcome again, and feel free to write down notes or put things in the chat bar. This webinar that we're doing tonight is in a time when we're dealing with and even extra kind of pressures surrounding COVID-19 and the changes that are happening in birthing facilities all over the country when it comes to taking precautions for safety for moms and babies, and we'll talk a little bit about that as well and what changes have happened from that. So, but I'm going to go ahead and get started. Awesome. So when many kind of expectant parents really envision what baby and birth is going to look like, those kind of ideas are different for everybody. For some, people wanted an unmedicated vaginal birth is what comes to mind when they imagine their ideal birth. And for others, a cesarean birth is part of that vision. So no one birth experience is right. It's going to be right for you as an individual. And tonight we're going to take a look at what a cesarean birth is, why cesarean birth might be done, and kind of what to expect when your baby is born via cesarean. The term cesarean birth is thought to be named after Julius Caesar. It was a word that was thought to be coined after the way that Caesar was born. However, there are some debates among historians over this fact. Cesarean birth or cesarean section is the process of your baby being born through an incision in the birthing parent's abdomen or uterus. And cesarean birth is an abdominal surgery and is commonly referred to as a C-section or cesarean delivery. Once the baby has been delivered through the abdomen, the uterus and the abdominal wall are closed using sutures or staples, depending on your obstetrician and that hospital. The exact type of suture and how the abdomen will be closed will vary, of course, from doctor to doctor. And we are going to take a look at the common reasons why cesarean birth may be necessary. Cesarean births may happen for a number of reasons. A medical reason may present itself before or during labor that makes a cesarean birth kind of the safest choice for the birthing person or baby. Or perhaps the birthing parent has a preference for cesarean births. So let's take a look at some common indications. For some parents, there will be a medical reason that indicates cesarean birth may be a safer for the birthing person, mother, and their baby. These reasons could be clear before labor begins, or for others, they may surface during the course of labor. Typically, cesarean birth, when it happens, is not something that is emergency. It will happen quickly, but is not necessarily an emergency. So some reasons for cesarean birth could be multiple gestation, active herpes outbreak, maternal HIV, severe hypertension or preeclampsia, baby's position, previous cesarean birth, placenta previa. Those are some common things that you may be reasons. So multiple gestation, not all babies who, not all parents who are expecting multiples have their baby via cesarean, but for many complications and different scenarios, cesarean birth may be the safest way for multiples, twins, triplets, quadruplets to be delivered. Active herpes outbreak, also known as HSV, is a sexually transmitted infection. There are 2 strains of this, and the first causes sores on the genitals and is referred to as HSV2. The second primarily causes cold sores, fever, blisters of the lips or mouth, and is known as HSV1. So these could be reasons if there's an active outbreak for baby to be born via cesarean. Awesome. HIV, maternal HIV is another reason, common reason for babies to be born via cesarean. The human immunodeficiency virus may be transmitted from pregnant person to baby during labor and birth. This is referred to as vertical transmission. And we're going to talk a little bit more about this, but one of the things that is a big concern for parents right now during the COVID is vertical transmission. And unlike the other coronaviruses that are out there, the COVID-19 is definitely not seeming to impact pregnant women in any higher rate or risk than the rest of the population. And it's not clear as of now whether vertical transmission is happening, which means that baby could get COVID-19 through while being inside of mom in utero. So the vertical transmission is not clear yet, but on a whole, there haven't been any cases that, many cases that reference that as a possibility, but there are a few. So in most cases, it is not a scenario that is happening when we talk about vertical transmission. Another common reason, and this is probably the one that I see more as a doula working with clients. So severe hypertension, high blood pressure. Many individuals may experience this just during pregnancy, or they may have this prior to becoming pregnant, which is just high blood pressure, elevated blood pressure, which may be something they're taking medication for or not. But severe hypertension can turn into preeclampsia, which is dangerous for mom and baby. So according to the American College of Obstetricians and Gynecologists, severe preeclampsia is defined as blood pressure of 160/10 or greater on 2 occasions, 4 hours apart while resting. Pulmonary edema or excess fluid that develops in lungs is also some of the common symptoms, as well as severe upper right abdominal pain, cerebral or vision disturbances, so seeing stars, different things in vision, increased liver and kidney enzymes, and low platelets. Definitely severe headaches are typical for a lot of moms who experience preeclampsia. Those with severe preeclampsia are typically managed on an inpatient basis and monitored closely for symptoms. Providers may not need to see all of the above symptoms in order to recommend immediate delivery. I have worked with a lot of patients who have hypertension and high blood pressure and are still able to have vaginal delivery. And that is on a case-by-case basis, working with your provider, depending on the severity of that. So it is one of the more common things that, as a doula, that I see reasons for cesarean birth. Fetal position. So we all know the optimal fetal position is that heads down, baby's head down delivery, known as vertex. When a baby is breech, their feet or bottom would be born first. This is definitely poses a risk to the baby. Oftentimes providers are definitely not trained in delivering breech, which is one of the reasons, more common reasons, that delivery via cesarean section is optimal. Something that you could talk to your provider about if you have concern about. Another common reason for cesarean birth is previous cesarean. So when an individual has had a cesarean birth with a previous birth, their provider may recommend cesarean birth. That often depends on that mom's reason for having her first cesarean. A lot of providers these days will be recommending a TOLAC, or trial of labor after cesarean, to try to have a vaginal birth after cesarean. It is the more healthier route for most women, but it all depends on your health and the reasons why you initially had that cesarean, your previous cesarean. So it's a good thing to talk to with your provider about. But a lot of providers are really recommending TOLACs for their patients. During pregnancy, the placenta is sort of that lifeline to your body, providing oxygen and other essential nutrients to your baby for optimal growth. Typically, when the placenta is implanted, it implants high and on the posterior or near your spine. Occasionally, it does get implanted in the front of your belly or low lying, and this can sometimes cause an issue where the placenta is too close to the cervix, that neck or opening of the uterus, and can be a cause for cesarean birth due to bleeding during labor. So we would be cautious. Your provider is going to be really cautious about doing a vaginal birth with placenta previa. For some individuals, that decision to give birth via cesarean may not be made until labor is underway. These are generally identified as sort of unplanned or unscheduled medically indicated cesareans. And we're going to take a look at the most common reasons a cesarean birth may be necessary once labor has already begun. During labor, your provider is going to be monitoring all of your vital signs for both yourself and your baby. These vital signs are an indicator of how each of you are handling the stresses of labor. And in some case, there may be a development during labor that makes vaginal birth less favorable. We will take a look at the following reasons that cesarean birth may be, that a cesarean may be indicated. Okay. So those include, we're going to just kind of go through those real quick. Fetal distress. The American College of Obstetricians and Gynecologists, known as ACOG, identify fetal distress as non-reassuring fetal heart tones, and is one of the more common reasons that cesarean birth may become necessary during labor. Your provider is going to be monitoring your baby's heartbeat. Like in this picture, you're going to see two monitors here. Your TOCO, which is monitoring your contractions, is going to be on your top, and your fetal heart rate monitor is on the bottom. Oftentimes, you're going to have to be following baby's heartbeat. So you kind of like have to, your nurse will help you kind of track baby as they move. She'll be shifting and checking that constantly. So they're going to be monitoring that and seeing how your baby is responding to contractions. Interventions such as breaking your bag of waters, also the use of Pitocin to induce or speed up labor, or choosing an epidural for pain relief may result in closer monitoring of your birthing, of you and your baby. And these interventions could interrupt the flow of oxygen to baby, causing what we call an abnormal heart rate, or sometimes often fetal heart turns can have late decels, which means that they're just not tolerating labor as well. So there's a lot of different factors that can take place. Other causes could be maternal illness, infection in the baby, umbilical cord compression, placenta abruption, or maternal positioning. So they're going to be kind of walking this through with you, changing position, making sure that that you're getting enough oxygen. So they may add an extra oxygen to mom, may add extra fluids for mom. They may sometimes perform what we call an amnio infusion, which just means that they're pumping saline solution into the uterus. I've seen this with several deliveries where providers are able to get extra fluids up into the uterus to help cushion baby from some of those cord compressions. There's really lots of different tools that your provider can do. And if baby still has some non-reassuring heart tones, then that would be cause for cesarean to be indicated. So another reason could be umbilical cord prolapse, where it can occur before labor. A prolapse is most likely when the bag of waters breaks either as labor begins or during the course of labor. This is not super common, so I don't want people to be stressed about this. If you have it, you will know pretty quickly if that was something that was a concern. So definitely not a common thing. It is often common concern in babies who are in a breech position rather than their head being down. Next one is that could happen is uterine rupture. Again, this is not a super common thing, but it is an indicator for cesarean birth. It is when there's a tear in the uterus, and the uterus is, it's like your biggest muscle in your body, outside of like your quadriceps for women. And this holds a baby, the amniotic sac. It is a super strong thing. This is definitely more likely if you have had a previous incision in your uterus, such as a cesarean birth. But even for moms who've had previous cesarean, risk is still pretty low. Oops, sorry about that. Next one is maternal distress. So as we spoke about before, high blood pressure like preeclampsia could cause maternal distress. In some cases, an induction may already be underway when those symptoms may worsen. So if you have high blood pressure or signs of preeclampsia, they're going to be doing an induction most likely if labor is not already started. If for some reason mom's health and symptoms tend to worsen, then your provider is going to be monitoring that to make sure it's still okay to try for a vaginal birth. If not, a cesarean birth will be recommended. So expected individuals may prefer to have a cesarean birth. This is called a consumer choice or cesarean on demand. And there's two main reasons why an individual may prefer to choose cesarean over vaginal. These include either a preference for cesarean with the first birth, or a preference for cesarean after a previous vaginal or cesarean birth. While birth may seem like a natural bodily function to some, for others, the thought of having vaginal birth may cause fear and anxiety. Some people may have a history of trauma that goes along with that, or trauma from a previous birth that makes a cesarean birth the best choice for them. So let's talk a little bit about how a cesarean birth is performed. This is something that we walk with couples through when we support them as their doulas, because we know that this can sometimes be the case. We usually it's not a planned cesarean, but sometimes it is. And we want parents to know what to expect so that they can enjoy the day their baby's born, as just like any other baby's birth. So it is really important, but it is also surgery. And so we want them to know what to expect and how they're going to feel about that. Um, the timing of a cesarean and your individual health factors will really determine often what type of recommendation of anesthesia can be used. For true medical emergencies, which I have really seen zero, um, but it does happen. General anesthesia, meaning that you're going to sleep, may be necessary. So for a true emergency, mom is often put to sleep. In that case, dad or partner is not allowed into the OR. But for most cesarean births, they are not emergencies, and a spinal or epidural anesthesia is typically used for that. So kind of to understand that process, let's from sort of start to finish. Um, your nurse or your provider will talk to you about the recommendation of cesarean birth, and they will typically give you time to talk about that, give you any other options if you have other options at that point, to be able to try for a little longer or try some other options. But once cesarean birth is decided on between you and your provider, there will be lots and lots of busyness that goes around. So you'll have lots of people come in your room. You will have lots of things done to you. You will get lovely hats to wear into the OR. Dad will get a lovely suit to be able to put on, included booties, and things will just kind of whirl around you. And so some of the things that I do as a doula is just kind of walk you through what to expect, tell dad how things are going to happen, how he can be helpful, what to expect. And mom's gonna, if she hasn't already had an IV with a bag of fluids, she's gonna get an IV with fluids. So if mom already has a cesarean, already has an epidural in place, then the anesthesiologist will use that to boost her medications during surgery to increase her pain relief through that. If she has not had an epidural placed, then a spinal will mostly be placed, which is very similar, but it will have different medications. But in either case, an IV will be delivering fluids and medications to you before, during, and after surgery. So they'll set all of that up. Also, a bladder catheter will be in place to empty your bladder during and after the surgery. A catheter typically will remain there for around 24 hours. Sometimes for some hospitals it's a little shorter, but they try as soon as they can to be able to take that out and let you go to the bathroom. An antacid medication, so to help neutralize anything that is in your stomach prior to surgery, will be given. Typically that's given IV. A surgical area will be prepped. So your incision will be in the bikini line area, and they will prep that and shave that where the incision will take place. So once you enter the, once everything's prepped and you have your hat on and you're ready to go, they will roll you into the operating room and drape a screen. Typically, this will come right below around your bra line or across your chest. And you will be transferred onto the table. Some hospitals do have clear drapes if that's something that you would like to have. So that's If they're available, you can request those. So if that's something that matters to you. Your abdomen will be washed with an antiseptic solution, and your provider will test to ensure you have proper anesthesia coverage and cannot feel the area that will be involved in surgery. Then an incision is made just above the pubic bone through the skin. Commonly, this incision is horizontal, approximately 4 to 6 inches, like I said, that bikini line. But in some cases, a T-shaped incision may be necessary. And a lot of times that will depend on maybe your baby's position sometimes and other factors. The provider will then separate the abdominal muscles to expose the uterus, and an incision will be made into the uterus. This incision is most commonly a horizontal incision, but sometimes can be a T-shaped incision or other variations. But once the uterus is open, the bag of waters will be open and suctioning of the amniotic fluid will take place. And then it is time for your baby to be born, and the baby will be delivered, that belly birth, through that incision in the uterus. For babies who are head down, the head will be delivered through the incision first. For babies, if your baby is breech, a provider may deliver the baby butt first. And for transverse babies, the provider may move the baby's head in a head down position first. Once the baby is born, the umbilical cord will be clamped and cut, and the baby is typically taken to the warmer, given a quick exam by a baby nurse, oftentimes a respiratory therapist. Sometimes another person is there, a pediatrician or other things, and they get a set of vitals. If baby is stable, oftentimes baby will be brought to you wrapped up. Some hospitals now are doing skin to skin, so you can have your arms free. Some hospitals do still require that arms are down, and partners at this time, a really great thing you can do is help hold baby, so mom can have that skin to skin or snuggle time. It's a little different than vaginal birth, so baby's a little bit higher because of the draping. So mom does lots of kisses and neck snuggles and those kind of things. Depending on your birthing facility, some birthing facilities do allow for you to be able to do breastfeeding right there in the OR. For some facilities, babies will either leave with baby nurse or go out with dad while mom gets finished stitching up. And then mom and baby will meet back probably within the end of that hour to get breastfeeding going. So when we think about how that cesarean birth, all those things I'm mentioning, that happens so quickly. So when they start with your cesarean birth, making sure after you're numb, baby is born within 5 to 10 minutes. And then there's about 30 to 45 minutes, depending, of making sure mom is stitched back up, everything is good, and then she's able to leave and go back into recovery. Sometimes that recovery room is the same room that you were birth or laboring in. Sometimes it's a different room depending on your birthing facility. So after your provider gets you all stitched up, you will be rolled back in. You will still be very numb. A lot of moms, when they're in cesarean birth, can feel really spacey because they're not used to the drugs. They can feel very nauseous. They can have a lot of shakes. This is all normal. Some of these things are also just what you're going to experience if you have a vaginal birth. And some women don't feel much at all. They don't have any of these concerns. So, but just note that that is normal. It's in the ranges of normal. They can give you some medication if you are nauseous, but the shakes are kind of hard. Those are definitely something that you'll have to kind of get through, and they wear off. But this whole process typically takes around 45 minutes, and it is it does happen very quickly. After your surgery, you can expect to stay in the hospital for about 3 to 4 days. Directly after leaving the OR, when you're in recovery, you're going to have about an hour of really close monitoring, blood pressure, your blood oxygen level, as well as your temperature. She's going to she's going to be monitoring your heart. You'll have these little sticky pads on your heart. You'll have something on the end of your finger to do your blood oxygen level. You'll have a blood pressure cuff on. You'll have those lovely, wonderful leg pumpers to make sure that you don't have any issues with clotting in your lower extremities, which is just a precaution for any type of surgery. So there's going to be a lot going on. It's really great to have an extra set of hands. So if you don't have a doula and there's not but one nurse in there, you can ask for another nurse to kind of help you get started with breastfeeding. Because I know that is important for a lot of moms. And there is that importance of making sure that happens in a certain window where baby is more alert and ready. But if it doesn't happen, skin to skin and snuggles are a really great option for moms to get that first kind of bonding in. And dads can do this too. Dads, you can wear a button-up shirt to the birth. That's a really great way to be able to have skin to skin if mom is not able to do that. So just to note, as far as recovery, you, depending on your provider's recommendations, you will stay in the hospital 3 to 4 days. If there's no complications. Occasionally, moms will be released before babies, or babies can be released before moms. But a lot of hospitals really work hard to try and make sure that you get to stay if you're released and baby's still there, or vice versa. So you will be encouraged to get up and move and walk. This is really important for that trapped air and gas in your abdomen. Some nurses that I work with recommend don't drinking straws, which could add to abdominal gas. You definitely moving, but moving slowly. I call this kind of moving like a granny. Because you've got a lot of pain medication, you don't really realize the damage that you could do if you do move too quickly with the incision site. So moving really slowly, using all of the support of your nurses, your providers, the rails on the bed, doing that in a really slow way is really important. And it will be important for you to move, but to be able to do it really slowly, incrementally, kind of. That incision site will be really tender. Some parents find that it's really easy, really helpful to have a pillow to kind of push against that site to protect it. As you're nursing your baby, you're holding your baby. The first weeks post-cesarean are often the hardest, right? Especially those first days. You will start to come off of your medications. I often tell parents that it's important to stay on top of your pain and talking with your provider and your nurses about what's recommendation, not to go too long without it so that you're in a lot of pain that would interrupt that bonding with baby. If you, upon leaving the hospital, if you're able to not do stairs a lot, will be a good thing. Your provider will not want you to lift more than the weight of your baby. So no extra lifting. That might involve having some extra support and also not driving. Right. So what to expect? If you do have an emergency cesarean, you do usually have time to get an epidural prior. Very few cesareans are emergencies, like I said. Let's see. I think I mentioned this, but typically if baby and mom are doing well, you're going to be back in the room together within the first hour or at the end of that hour. And it can take anywhere from 1 to 4 hours for you to get your full feeling back in your body. It is really hard for moms to be able to sit up and feed their baby how they imagine feeding it. So I often help support moms doing what we call laid back nursing. It is a really wonderful way for cesarean moms to be able to nurse their babies. Let's see. All right. So I am going to, I will send you guys a list of my sources to create this webinar, and I appreciate you coming and talking with us tonight. Again, our doulas are here to help moms no matter what type of birth they want to have or end up having. And we are there with you through it all to help you, kind of guide you in that time, understanding what to expect, and supporting that journey however it unfolds. One of the things that we also do now with the COVID is provide virtual services for parents. So we do a lot of consulting for parents if they are going through labor and want virtual support but are unable to have in-person support. We also do that. So if you're interested in that, let us know. We also do postpartum virtual support to help support breastfeeding, taking care of baby, and just navigating bringing your baby home for the first time. So at this time, I'm going to stop sharing, and then we're going to talk a little bit more about what to expect during this time of COVID. So I'm going to unmute. Let's see if I can unmute you. Yeah, Lindsay. And hi, I just want to, I haven't opened the chat bar, but I want to take some time to be able to answer your questions. And